Today we're tackling a subject that's often misunderstood and emotionally charged: brain death. Many people confuse brain death with coma, holding on to hope for recovery. But brain death is final. There's no coming back. Understanding this isn't about giving up hope. It's about facing reality with compassion and making informed choices for our loved ones. When families hear the words brain death, they're overwhelmed by grief and medical jargon. My goal is to provide clear, simple information to help you navigate this difficult topic. By understanding what brain death is, how it's diagnosed, and why it's considered the end of life, we can make better decisions in heartbreaking moments. Misunderstandings about brain death can affect organ donation and public trust in medicine. As a neurosurgeon, I've seen the pain and confusion this topic brings, but also the peace that comes from clarity. When families have honest information, they can honor their loved one and find strength in the hardest times. This conversation is about bringing light to a difficult subject, so we can face it together with knowledge and compassion. A brain death is the complete and irreversible loss of all brain function, including the brainstem, which controls basic life functions like breathing. A person who is brain dead has no awareness, no pain, and no chance of recovery. This is very different from a coma or vegetative state, where some brain activity remains and recovery is possible, however unlikely. In brain death, there is no brain activity at all. Legally and medically, brain death is recognized as death in many countries, including the United States. Machines can keep the heart beating for a short time, but this is not life. The brain is gone. The hardest part for families is seeing a loved one's body still warm and breathing with a ventilator, but the person they knew is no longer there. Accepting this reality is an act of love, allowing for a peaceful end and sometimes the gift of organ donation. Understanding brain death helps families make informed, compassionate decisions. It's a final, irreversible state. There is no coming back. Recognizing this distinction is crucial for everyone. Brain death results from catastrophic injury, like severe trauma, stroke, or lack of oxygen. The brain needs a constant supply of oxygen. Without it, brain cells die within minutes. Swelling, called cerebral edema, can increase pressure inside the skull, cutting off blood flow to the brain. As pressure rises, the brain is squeezed, blood vessels collapse, and oxygen stops reaching brain tissue. This is the point of no return. The entire brain, including the brainstem, dies. The tissue begins to break down irreversibly. Even if the initial injury was small, swelling and lack of blood flow can destroy the whole brain. This is the physical process behind brain death: total, permanent loss of all brain function. It's not a disease, but the end result of overwhelming injury. Understanding this process helps us grasp why brain death is truly final. Diagnosing brain death is one of medicine's most serious responsibilities. Strict protocols require 2 independent doctors to confirm the diagnosis. First, they rule out conditions that can mimic brain death, like drug overdose or hypothermia. The cause of the brain injury must be clear and irreversible. At the bedside, doctors test for any brain or brainstem function, checking pupil response, gag and cough reflexes, and eye movements. None of these reflexes will be present if the brainstem is dead. The final test is the apnea test. The patient is taken off the ventilator to see if they attempt to breathe as carbon dioxide rises. If there's no breath, it confirms the brainstem is no longer working. Only after all these steps is brain death declared, an irreversible, legal, and medical end of life. This careful process ensures accuracy and protects everyone involved. It's a decision made with the utmost seriousness and respect. While brain death is final, many causes are preventable. Simple actions, wearing seatbelts, using helmets, and child car seats, can prevent traumatic brain injuries. Managing health conditions like high blood pressure, diabetes, and high cholesterol reduces stroke risk. Avoiding smoking and limiting alcohol also protect your brain. In emergencies, quick action matters. Call for help, start CPR if trained, and recognize stroke signs with the FAST acronym. In hospitals, teams use advanced techniques to control brain swelling and protect brain function after injury. Sometimes surgery or medication can give the brain a chance to heal. Prevention and rapid response are our best defenses. While not every injury can be stopped, these steps save lives and brain function. Protecting your brain is protecting your life. Understanding brain death is about more than medical facts. It's about compassion and dignity. For families, clarity brings peace and helps them make decisions that honor their loved one. It also enables the gift of organ donation, turning tragedy into hope for others. Public understanding builds trust in the medical system and the donation process. Strict protocols ensure every diagnosis is accurate and ethical. This knowledge empowers us to face life's hardest moments with courage. By replacing fear with understanding, we support those who grieve and make better choices for ourselves. Brain death is a difficult reality, but talking about it helps us honor life, even in loss. Knowledge and compassion are our greatest tools in facing the end of life.